pathophysiology of erectile dysfunction or impotence. This is a disorder in which the person cannot attain and maintain erection of the penis for sexual intercourse. The penis of human being consists of three erectile tissues: corpus spongiosum, in which urethra is located, then two set of left and right corpora cavernosa. The corpora cavernosa are actually the erectile tissue, in which there are penile vessels, nerves, and the smooth muscle connective tissues. Actually, it is the most important part of the penis. Then there are nerves, sensory nerves, glans penis, which has a very delicate network of sensory nerve fibers. So when sex arousal is produced by the person himself thinking about the sex or the physical contact with the penis, by the opposite sex partner, or by self manipulation by hand. So these produces stimuli that runs through the sensory nerve to the sex centers in the brain. Then sex center interpret these sensations and transmit orders in the form of electric currents through the nerves fibers, which travel through the spinal cord up to the penis. So when sex arousal is complete one, and the understanding of the sex desire is interpreted in the sex centers, they produces orders through the nerves, which goes to the penis. The nerves ending then secrete and produce nitric oxide, which is a very important component in maintaining the erection of the penis. This nitric oxide produces relaxation of the smooth muscles of the blood vessels, due to which the vessels they are dilated. When they are dilated, blood gushes in the erectile tissues with force. These erectile tissue has spaces which collect the blood, and they are swollen up, and the penis is erected into full position. Normally, the full erection, the length of the penis is from 5 to 6 inches. Rarely it may exceed above 6 inches limit. But however, I have seen in patient reaching up to 7 inches. But they are abnormal, though it is in present in normal person, but I consider they are inhuman one. Normal length of the penis should be 6 inches, from 5 to 6 inches. Now, when there is erection of the penis, person can perform, if he is normal in certain sexual strength, can perform his sexual desire up to 5 minutes. That is the orgasm or the climax of the sex satisfaction. That is the period is 5 minutes. So this process is a physiological one. But in case of erectile dysfunction, there is disruption in the transmission of the orders from the brain, sex center, to the nerves of the penis. There is pathology, disruption, distortion due to certain pathologies, I mean dementia. Then there is Alzheimer's disease, Parkinson's disease, spinal obstruction due to tumors or the disc diseases, pathologies, spine protrusion, disc protrusion, spine deformities. So these produces obstruction or impingement over the concerned nerve fibers. So this is a neural factor. There is obstruction in the nerve pathway due to which nitric oxide is not produced and the blood circulation is not normal one. Next, if it is a normal passage of the nerves orders in the person, then next is there is pathology in the nerve, blood supply, blood vessels of the person. There is plaque formation, atheroma due to high cholesterol, bad cholesterol in the blood, instead of deposition of the small vessels of the penis. So they are narrowed one. They become rigid. They can't expand. So in spite there is normal production of the nitric oxide, there is no benefit because the vessels they are narrow one, so blood circulation cannot be enhanced. The blood circulation is not boosted up. So this is a second factor for erectile dysfunction. These are the two main ones. Other factors are etiology factor, they are the secondary ones. Next is the function of the male hormone, testosterone. Testosterone hormone produces sex arousal. Desire for sex function is produced by this hormone. And this hormone is produced by the cells of the testes. But the actual function in the penis for erection, rigidity, firmness, wholeness of the penis is by the nitric oxide produced by the nerve endings and nerve fibers supplied in the penis. So this is a physiology and pathology in erectile dysfunction or ED. Now the secondary causes excessive use of alcohol, excessive tobacco smoking, then sedentary habits, certain prescription medicines, they are also responsible. Thiazides, antihypertension medicine, antihistaminic, antidepressant, anti-anxiety medicine and drugs, they also produce or contribute or enhance this disorder, erectile dysfunction disorder. So these are the main factors, especially the foremost factor is diabetes. In diabetes, there is a peripheral neuropathy, especially in the penis nerves, so they become numbness and sensations are impeded. They can't catch the orders from the main center of the brain, so they are weakened one, due to which the production of nitric oxide is diminished and lessened. So diabetes, obesity and sedentary habits, they are also the causative factor for erectile dysfunction.